and 17 verses 6, right? We talked about this before a little bit. When they did the treatment, they got significant improvements, very significant improvements. Now, what's interesting is Jill didn't manage to get them back to the baseline numbers with this trial, but she got some significant improvement. What's really exciting is, and I'll put it out there as a teaser and we'll talk about it some more afterwards, when we use OSR in our kids, and Jill did some data measurement for us, we got way back to past where the normal kids are. We really raised these glutathione levels and really reduced the oxidative stress in our children. So we'll talk about that a little bit more after. All right, so how do we help? We manage all this stuff. We manage the gut disease. We manage the immune dysregulation. We manage the inflammation. We manage the oxidative stress. Now, what if there was a way to get at all of those things at once? That would be cool. That would rock, wouldn't it? Okay. I'm going to talk about hyperbarics. And I don't remember where the slides are that I stuck in here about this, but I'm going to talk about them. I'm going to spend a few minutes on this. I think it's really, really important. One of my patients walked up to me before the talk and she said, there's all the talk about this one study and I've got to sell my hyperbaric chamber on eBay because it doesn't work. All right? I'm standing here in front of you to tell you that hyperbarics is the single most useful thing I have ever implemented in my practice. Okay? Now, here's what's important to understand. Remember we talked at the beginning of the talk about like Galileo and about Lynn Margulis, and people said stuff and found things and then they said, well, you're nuts. The way medicine works is that we find something in our clinical practice because crazy people like me step out into the void and say, I'm going to try this. And it looks really cool. Wow, we see something great happening. And then we start trying to quantify it. We start trying to measure it. We start trying to figure out why it's working. And we start to do research so that we can make other people listen to us. And sometimes studies work out well, and sometimes studies don't work out well. But that doesn't mean that it doesn't work. If you have your eyeballs on and you see a child improve clinically, then what you're going to do is go work to figure out why and see how you can prove it. You don't do one study in the face of many others that have said it does help and say, well, it doesn't work. Okay? That just makes me mad. Don't do that. All right. So, hyperbarics. You take air from the outside and you stick it inside the cell. That's what's supposed to happen. When you use hyperbarics, what happens is the gas, that oxygen, is under pressure. And it makes it more likely to dissolve into a liquid. My husband's a mathematician, so I had to put a math formula up there for him because, you know, he would feel included because he doesn't like to come to conferences. So this is Henry's law, and it says that when I put the oxygen under pressure, it's going to dissolve into a liquid. Okay? Now, when it's oxygen dissolving into blood, what happens is, first, you saturate up the red blood cells. Aren't they beautiful? They look like donuts. I don't eat donuts anymore, so I'll just use these guys. All right? They look like donuts, and the oxygen attaches to those red blood cells. When the oxygen's under pressure and you fill up all the red blood cells, the oxygen has to have somewhere to go, right? It goes into the serum, the plasma, the liquid all around the red blood cells. Okay? Now, that's important because when it gets to the owie, whether the owie is your post-operative surgical wounds, or whether the owie is the brain with autism that has decreased blood flow to certain areas, and brain cells that are dormant, not dead, but dormant and not functioning, when that oxygen gets there, the oxygen that is attached to red blood cells only goes about this far. It's a very scientific measure. It's actually like about this far, right? It goes about this far. The oxygen that is free floating in the plasma, it works like a tsunami wave, and it washes in and goes way into the next room in terms of how far it can travel to help the owie. Okay? And so what's happening is when we put our children into chambers and some of them get out and they say their first words and they so obviously feel better, we suspect that what's happening is not new blood vessel formation, because you don't form new blood vessels in 1 hour.